This is the VKH Dojo, the Vogt-Koyanagi-Harada Syndrome Dojo, where we're going to be talking about this condition and some of the salient features. So VKH is an autoimmune granulomatous panuveitis that is believed to be due to a T lymphocyte-mediated reaction against melanocytes. It affects pigmented structures such as the eye, inner ear, meninges, skin, and hair. And at this dojo, the ninjas here are mostly just wearing black ninja suits, and we chose that color to remind you that the melanocytes are the main source of autoimmune inflammation. Sometimes this condition is known as Harada disease if only eye findings are present, and it is characterized by a rapid loss of vision, whereby the second eye is involved within 2 weeks of the first eye. It is more common in Asian and Middle Eastern countries and seen in Japanese, Chinese, Middle Eastern, and Native Indian patients. It is the most common cause of non-infectious uveitis in Brazil and Saudi Arabia, and because it is more common in Asians, Indians, and Hispanics, and rare in Caucasians and Africans, we've decided to choose a dojo in Japan, and this is pretty characteristic of the patient population. In fact, this disease is named after two Japanese ophthalmologists, Koyanagi and Dr. Harada. So, the autoimmune haplotypes with a gene association include HLA-DR4, characterized here by 4 doors, which will also characterize the 4 stages of VKH, and HLA-B54, characterized here by this B54 fighter jet. So let's dive into this Japanese dojo and talk about the salient features of this condition. There are 4 stages, and the first stage begins with the prodromal stage. This stage is characterized by fever, nausea, and flu-like symptoms, characterized here by this dirty wastebasket filled with tissues. Also, you may have meningitis-like symptoms such as headache and neck pain, characterized here by this red neck brace, as well as tinnitus and dysaceusis, which is characterized by this ninja holding her ears. Auditory problems are observed in 75% of patients, and they frequently occurred during the time of ocular disease. Central dysaceusis, which usually involves the higher frequency or tinnitus, can affect 30% of patients early in the disease course, typically improving within 2 to 3 months, but persistent deficits remain after the condition resolves. So a few days later, patients move into the acute uveitic stage, and this is characterized by a bilateral granulomatous anterior uveitis, characterized here by red grapes, vitritis and choroidal thickening, seen here by this red thickened doorframe, and optic disc hyperemia and edema. In addition, patients develop multiple serous retinal detachments, characterized here by these pink flowy drapes. And the treatment at this point is aggressive steroids, topical, periocular, and systemic. Weeks later, the patients will move into the convalescent stage. This results in retinal detachment resolution, so the drapes are gone. Perilimbal iris vitiligo, known as Sugira sign, and poliosis, characterized by this white tape underneath the eyes, and alopecia, so this ninja is bald. One of the common catchphrases for VKH is a sunset glow fundus, characterized by this nice tropical sunset poster hanging out behind this ninja. One of the other questions you might see include the names of the nodules that are formed, and those are known as the Delenn-Fuchs nodules, characterized here by this hanging granulomatous decoration full of lanterns. Just to remind you, I decided to add these nodules into other places here. So you might see that there are lanterns hanging outside the dojo as well. So These nodules are made of epithelial histiocytes and lymphocytes that are present between Bruch's membrane and the RPE. Lastly, moving into the chronic recurrent stage, if not treated appropriately, these patients may develop iris depigmentation, characterized by this white t-shirt, cataract, characterized by this cat, glaucoma, characterized by the glaucoma glauc, and also recurrent uveitis. The worst part of what can develop include choroidal neovascularization, characterized by this hose that's leaking, and subretinal fibrosis, which may lead to very permanent vision loss. So one of the other findings in VKH is something known as a starry night, seen on fluorescein angiogram. And these starry night things are due to lymphocytic infiltrates. And so just to remind you of this peculiar FA finding, we've decided to add a starry night background. So one of the things that comes up is whether or not this patient that presents in front of you may have VKH or sympathetic ophthalmia. And you might notice that none of these ninjas are particularly well equipped for a feud. No ninja stars or katanas or anything. And this is to remind you that VKH is not associated with any ocular trauma, which is the first way of distinguishing VKH from sympathetic ophthalmia. In addition, these flowy drapes, as well as this choroid involvement, including the choriocapillaris, is more common in VKH than sympathetic ophthalmia, whereby ophthalmia spares the choriocapillaris. And of course, we're at a dojo, and we have, which is in Japan, and we have a Native American headpiece here. And all these features are just to remind you that there is a racial predilection for VKH, whereby sympathetic ophthalmia does not have any racial predilection. So, until next time, good luck from your friendly neighborhood VKH ninjas.